Namaste. Welcome to Clinical Ayurved by Dr. Mayuresh Agte. We were discussing Annahodas Vyadhi and I had discussed with you Atisar Samprati in detail. In last lecture, I discussed that in Samprati of every disease, Samprati Ghatak are important, we should know them thoroughly, but only the their names or decision is not important. We should understand which factor among them is dominant and how the treatment revolves around that dominant factor. So, in each samprati of any vyadhi, you should know which is the major factor and you should focus on that when you are going to treat that patient. So, in the last lecture, I asked you one question that in Chardi there is expulsion of some liquid material through mouth and in Atisar through loose motions. I have asked you one question that if you compare in practice that there is a one patient of Chardi and another patient of Atisar in front of you, you will find patient with Chardi specifically tells you that I got only one vomit and I was exhausted. Another case in Atisar, he says, okay, 2-3 times I went for the loose motions, but I was okay. After that, I started feeling weak. So I ask you, in both the patients, there is something is expelled out of the body, but in Chardi, we find that one Chardi is also enough to get the patient exhausted and Atisar takes some more time or more Vegas. Why this difference happens? Now, let us compare Samprati of both for this answer. In Chardi, what we have seen, there is Dosho Udarana and Udan Vayu expels all this content in the Amashay through the mouth in Chardi. And in Atisar, what we have seen, Vayu and Jala are Vyadhi Samprati, main factors of Samprati, but Vayu in that case is just a triggering movement is of Vayu. It just stimulates that Jala to flow down the coaster and expels it out. So major factor in that case is Jala, and in Chardi, Udan is so prokopic that it forcefully expels everything out. Now, what happens if you compare the karma of Vayu, or if you keep in mind the karma of Udan Vayu, Vak Pravritti Prayatna Urja Bala Vanaspruti Kriya. So, what happens? The Bala of the Sharir, whatever it is, quantity wise, Madhyam Bala, Alpa Bala, Uttam Bala, whatever it is, the Bala is under the karma of Udan Vayu. So, when Udan Vayu gets Prokpi, it expels the content with much more maximum force out of the body. And in Atisar, as we have seen, Vayu has just a stimulant action, Prerane Chalaha. So, in that case, Jala is dominant, it flows by its Dravaguna from Urdhagati to Adhogati and gets expelled out. Vayu is there, Vata Prabhu is there, but in Chardi, the dominance of Udan Vayu is much more greater than Vata Prakop in the Atisar. So, when Udan Vayu gets Prakopi in Chardi, it expels with whole force, and that's why patient gets exhausted very fast. See, this rule applies in every conditions of the Chardi. It means in woman also you will find that as compared to other Panchakarma, woman is more dangerous, or we have to take more care because you are provoking Udan Vayu and getting the getting the Dosho Udirana expelled out of the body. So, in woman, you are provoking that Udan Vayu which has Balavan in the body, which has got a hold of Bala, of Sharir, and if you are provoking that Udan Vayu, then it will work with the maximum force available to that Udan Vayu. So in practice you will find that one Chardi or maximum two wave of Chardi are more enough to get patient exhausted, because there is Bala Hani, Udam Prokopit, and that Bala Hani makes patient exhausted. In Atisar, Vata Prokop is there, but Jala is dominant. So compared to Chardi, again underline, compared to Chardi, patient can tolerate 3, 4, 5 Vega of Atisar, and then he feels weakness because of resumption. So when you are treating a patient or any Vyadi, always keep in mind the karma, Prakrut karma of every Sharir Ghatak, those Jatu Mala, and on the background of that karma or Prakrut Sharir Kriya, you have to evaluate Nidan Panchak and then Samprapti and then whatever Chikitsa you are going to do. I know this topic today is maybe you will find more academic, but it is clinically important, because many a times when treating a patient of any Vyadi, we forget the Prakrut Sharir Kriya and its application. So in Chardi there is Balahani, because there is Udan Vayu Prakop, which is the most, which has got the hold of whole Sharira Bala, and that's why, like Chardi in the Vamana also, if it doesn't get, or it's Atiyoga of Vamana, it is always becomes very, it's an emergency, because Atiyoga of Vaman, in Atiyoga of Vaman, you have to control Udan Vayu as early as possible, otherwise the Bala of Sharir will be destroyed at a very high level. So in both the conditions of Chardi and Atisar, though there is water loss, clinically we will find difference in the patient's condition after Vega of Chardi and Vega of Atisar. So always keep in mind the karma, Prakrut karma of every Sharir Ghatak of whether dosha, dhatu or mala, and always try to evaluate the samprapti of the disease on the background of their Prakrut karma. Thank you very much.